Hepatitis is basically inflammation of the liver that's caused by a virus. There are two different types: acute, which can last less than 6 months, and chronic, which is when hepatitis lasts more than 6 months. And the most important thing to remember about chronic is that if it's left untreated, it can cause permanent liver damage or even death. Although there are 5 different types of hepatitis, hepatitis A, B, C, D, and E, they all have the same symptoms and causes because they're all viral infections of the liver. So when you're looking at symptoms, there are things like fatigue, flu, and fever, which basically have to do with any sort of inflammation. But light-colored stool and jaundice have to do specifically with the liver because they have to do with the amount of bilirubin in your body. So as you can see in the picture right below, this is just an example of what the colors of healthy stool should look like as compared to light-colored stool. And in the other picture to the right, you can see what jaundice looks like. You can see how the skin's more yellow and how the whites of your eyes are a lot more yellow too. And then if you look at the causes, basically hepatitis is caused when you ingest something that is contaminated. It mostly has to do with fecal matter. So if you're eating food that's been in contaminated water, or if you're drinking contaminated water, or it also has to do if you have sex with an infected partner. So now we're going to move on to the different types of hepatitis. So hepatitis A is one of the more common types of hepatitis. As I just described in the causes and symptoms, it's usually received through contaminated food or water. The really nice thing about this hepatitis is that it's not very severe, so the body can heal on its own, and you can basically prevent it by having good hygiene, such as washing your hands, making sure you don't have too much contact with infected persons, and also you can take a vaccine so that you can prevent yourself from getting hepatitis A in the future. So hepatitis B is also caused by sharing of bodily fluids, but there are several differentiating factors between this type of hepatitis and the others. So in hepatitis B, mother can pass hepatitis on to her fetus. So that's a very important point. And also, in hepatitis patients, if they develop a chronic type of hepatitis B, they can actually become carriers. So what that means is, even if they don't present signs and symptoms of having hepatitis B at that time, they can pass it on to other people through sharing of bodily fluids. Another important thing is if you develop hepatitis B in a chronic form, then it can actually cause cirrhosis and liver cancer because it's just destroying your liver more and more as time goes on. But similar to hepatitis A, there is a vaccine that can prevent you from receiving HBV as long as you take it before you receive the virus. So now we're going to talk about hepatitis C. So most people receive hepatitis C through contact with blood or contaminated needles. So as you can see on the picture on the right, 60% of people with hepatitis C receive it through injecting drug use. So most of the time the symptoms are mild, but in 25% of HCV cases, they can develop cirrhosis of the liver 20 to 30 years after. So that's pretty interesting. And in fact, this is one of the only types of hepatitis that you can actually receive medication for. A very rare form of this disease is hepatitis D, and that's because it can only affect people who have previously been infected with hepatitis B. And basically, D makes B more severe. And so the reason that only people with hepatitis B can develop D is because D is structurally unrelated to the other hepatitis viruses, and as a result, it needs hepatitis B to replicate. And so people who develop hepatitis D usually develop it alongside hepatitis B, which is known as co-infections, or they develop D as a result of developing HBV first, which is known as a superinfection. The last type of hepatitis we're going to be talking about today is hepatitis E. Now, this is most common in the developing world. So as you can see on the map on the right, it's in places such as Mexico, Africa, Asia, and India. And although it's not chronic, it is slightly more severe than hepatitis A. This is especially important in pregnant women because if they develop hepatitis E, it can cause severe liver damage and possibly even death. And unfortunately, for this type of hepatitis, there is no treatment.